From Buffalo Toronto Public Media and WBFO, this is What's Next, Producer's Picks, highlights of conversations heard from and on previous shows. On this week,
and the issue around the valuing the humanity of Black people.
We hear from Pastor George Nicholas. Then we continue with...
Our goal is to really sell, I tell everyone that I come in contact with, I don't sell bags, I sell confidence and I sell self-esteem. And those things are quite important to me.
Local artist and leather craftsman Dame Powell. I'm Dallas Taylor. Thanks for listening. We start off with Jay Moran speaking with Pastor George Nicholas, leading up to Igniting Hope 2023 that took place in September. The two discuss health disparities in the African American community amongst women in Western New York and the importance of igniting hope.
Your relationship here really goes back a few years to the African, the task force that took a look at the disparities when it came to medical and health outcomes for African Americans here in the city of Buffalo. Can you take us back to that time, what it was like?
Sure, yeah. That was, I think it was 2014 or 2013, and a small group of us began to engage in conversations about colorectal cancer and the disproportionate number of African Americans who were suffering about that. And I challenged the group to, let's look deeper. Let's look at, all chronic diseases and seeing, what's the story, what's going on in the African American community in this region. And so we began to look at data and outcomes and from the state and the county, and we discovered that, if you were African American and you were living in the African American community, 5 or 6 zip codes we focused on, you would be 300% more likely to have a chronic disease than if you were white and lived outside of those things. So we're talking about diabetes and hypertension, different types of cancers and heart disease, and all these things that can, they're preventable in some ways, or at least manageable, right? And the reason why we have such terrible health outcomes in the Black community and the health disparities exist, they're so pronounced that when you look at the state does an assessment of county health, what's the health of a county, and they look at all kinds of outcomes, that you would look to assess public health. And every year, Erie County, there's 66 counties in the state. Erie County consistently ranks 64 or 65, one of the worst in the state. But then when you begin to look at the data and begin to pull out the poor health outcomes of the African American community, which makes up maybe about 12 to 14% of the county population, those numbers are so starkly they're so poor that it pulls the total number down. So when you look at the health outcomes for white people in Erie County, they're right around in the middle of the state, right? But the numbers for Black people are so significantly worse that it pulls the whole number down.
And just to be clear, when we're talking about Black people living in Erie County, considerably lower than, say, Black people living in New York City.
Yeah.
Rochester.
We have some of the worst in not only some of the worst in the state, but some of the worst in the country.
Wow.
Right here in the city of good neighbors, and it's been documented. And so we have been working on developing a kind of response. I think one of the first things we wanted to do is to understand the data, and to understand why it is that way. A lot of times people will immediately jump to behavior, and behavior is part of it. But
wasn't that almost a cliche?
Well, yeah, I mean, that's what Black people eat too much fried chicken and do whatever, and that's why you all got high blood pressure. Well, that's not necessarily the case, right? And so every leading health organization, whether it be the Center for Disease Control or the World Health Organization or any reputable medical school or that looks at public health, will tell you that what drives health outcomes are the social determinants of health, the lived environment. That will be 60 or 70% of the determination of what your health outcomes will be. So when you have great disparities in, for example, income and wealth, right? Well, we know here that in this country, the wealth gap is as bad as it's been in the last 40 or 50 years, where it depends on what study you read, but for every dollar of wealth an African American has, a white person will have $18. And so it's significant, right? And then when you look at educational outcomes, right, here in the city of Buffalo, people always talk about graduation rates, but that's one indicator. But another indicator, which I think is more important, is whether the child is at grade level, right? And there is no question, the data shows that African American children in the Buffalo Public Schools are 2 to 3 grade levels behind where they need to be, and the majority of them, right? Which will, education is one of the best indicators of potential economic advancement, right? And so now, when we have so much massive poverty on the east side of Buffalo in the African American community, it's tied to a lot of factors, but one of them is the factors of the educational outcomes, right? So you have great organizations like the Northland Training Center that will provide great opportunities for people to get training to get some pretty good jobs. But you have to be able to pass this thing called the TAVE test, right? And you got to be operating at least at the 8th grade math level, I believe. And so, and there's a challenge.
A lot of kids are being left out because of that.
Yeah, and it's not their fault, right? And I mean, see, we got to understand the distinction between a person having responsibility and whether or not something's their fault.
Okay,
right,
all right.
Right. You know what I mean? And so, if we have a system which makes it exceedingly more difficult for a person to achieve, right? Well, achievement is connected to opportunity, and so if you're not providing the same opportunity for a whole subset of people, why would you believe that their achievement would be at the same level of people who do have those opportunities?
Right.
Right. And so what we ought to work for in this community is that the educational outcomes for children, African American children in the city of Buffalo and in other pockets too, would mirror the outcomes of white children in Williamsville and in Orchard Park and in Clarence. That's what we should be shooting for. I mean, and every child should have that right.
I was just going to say, does it frustrate you though when those arguments about just talking about school in general? We're kind of getting off the topic, but I had an idea that if I was with you for an hour, we could get into a lot of different things about this. But that all of a sudden the argument becomes about, well, this is my district, this is what we pay, that kind of thing.
It's ridiculous. I mean, there's a moral argument, right? That as responsible adults have a moral obligation to provide a kind of a community of caring for every child, right? I mean, we have that. It's just a basic moral responsibility in any civilized situation, right? And we got to stop blaming children for things that maybe they don't have as much control over as we think that and stop asking children to have Herculean efforts just to basically be able to do the basic things in order to succeed, right? And so it's all about what's important to us as a community. And so we know that if your educational attainment is not as where it ought to be, then it's going to be more difficult for you to get a good job, right? If you don't have a good job, it's going to be difficult for you in order to make the kind of income that's going to allow for you to purchase a home or rent a home that is going to be something that's going to provide a sense of comfort and security for you. Dr. Henry Taylor, in his report, The Harder We Run, documented the just dramatic disparities in housing quality on the east side of Buffalo. And we saw evidence of it, or the outcome of it, was when we had our blizzard. And while African Americans make up about 12 to 14% of the county population, we were 50% of the deaths from that blizzard. And we're looking at some other data with some of our partners with Healthy Link and others that are looking at hospitalization, frostbite, and hypothermia, and other things, and some of the emergency room data from that period. And we're finding just in preliminary look that there was a disproportionate numbers coming out of certain communities. I guess you can guess what those communities were. And we know that, in terms of the housing stock and whether a home is properly weatherized and all these other things will have an impact on what happens inside that house if a blizzard hits, right? So for example, if the power goes out in a home that's at standard, whatever there are
Sure,
standards,
there are
right?
definitely standards. Yes.
Right.
Yeah.
Then you can expect the maybe the home to get down to 55 degrees, 50, which is cold,
Oh, yeah.
for a short period of time. If it's not properly done that way, and if the electrical system and other weatherization pieces that you're supposed to have in a home that's at code, then that home will drop to 30 degrees. And again, Dr. Taylor speaks much more eloquently about this because he's done a lot of the data and done the research. And that's, again, attributed to public policy that has allowed for, housing standards to be at one level in one neighborhood and at another level in another. And then when you put into the equation income and rent, right? And if you're paying, I guess you probably want to pay about 10 or 15% or some 20% of your income on rent. But if you start paying, 40 or 50% of your income on rent, right? And then the unit that you're renting is not at code, right? Then it just creates a kind of uncomfortable and unhealthy environment, right? So now, just think about just the stress that folks have, and a lot of times these people are working people too, right? And so, but it's difficult in some places to kind of elevate yourself within the work environment you have, or find a place because you haven't had the opportunity or the access to the kind of training and other things that can elevate your skill level, right? Or maybe you don't have the time, right, to take that extra course because you have a child at home and you can't afford for childcare. All these different dynamics that just are these constant hurdles that people have to overcome. There's some people who do that, and great, and we applaud them, right? But that shouldn't be the kind of everyday existence for people in a community just because they're black.
Before we went on the air, you said you kind of looked at the city of Buffalo and some of the issues, the many issues that linger, especially for the black community, and there's almost onto there's this lacking of a comprehensive approach, and so we're getting into housing a little bit now. Maybe for somebody who probably talks to a lot of different people, whether they're part of your congregation or others, what are you seeing with some of the housing around Buffalo?
Well, again, I mean, it's been documented. Dr. Taylor's report, right? And then or just driving through communities, or when I get a chance to visit some folks in their homes, and and these are hardworking people who are doing the best they can, right? And you have all these vacant lots, on the east side of Buffalo, right? And you have some pretty high, rents are increasing for people, right? And so you have rents increasing, food costs increasing, but income's not increasing. So again, what do you think? That's a formula for disaster. We know that there are issues around lead in the air and water quality. All this has been documented, but yet what we haven't seen is the type of comprehensive plan. I applaud the group in the organization. I think there's a group that just got a federal grant to plant trees on the east side.
Right.
That's tremendous. I mean, and that's a tremendous first step because, certainly trees have an impact upon the environment, right? And sadly, we have found whole sections of the east side where, there were no trees, and they were cutting down trees, which I don't understand. You know what I mean? And
Right.
so I think that kind of work is very, very important, because what's happening is we have these health outcomes, right? That in some places, people are living 10 to 12 less years if you live in certain communities.
Mm-hmm.
And that's just like, again, it's just not right. And then you also have the economic impact of, when you have the high cost of healthcare and the high cost of people who are struggling with chronic diseases and need very expensive treatments, right? And a lot of those things can be avoided, right? Or can be diminished, right? If we make some pretty dramatic but achievable or doable, realistic adjustments in how we invest resources and what we prioritize in this community. So this is why it's so important for us to have this Igniting Hope Conference.
Okay.
And what we've been able to do through this movement, right, is to...
You consider that a movement?
Yes.
You feel that
movement.
type of...
Yeah, it's got to be, because that's the only thing that's going to bring change. So institutional changes don't come at a level that's impactful unless there's a movement that's pushing it, right? So systems are designed to sustain themselves, right? And so in order to get a system to do something that maybe not directly impact its own ability to sustain itself, but is something that will impact other people, right? You have to. They're not good people. The systems don't do these things voluntarily. They have to be. They have to be pushed, quite frankly. And so by bringing these issues around health disparities up, and then pushing for health equity, and one of the, and here we clearly, that COVID wasn't a positive thing, but one of the positive things that came out of COVID. So I don't want nobody saying, pastor said COVID was a good thing.
No.
Yeah. But that one of the things that came out of that was it shined a spotlight upon the African American community, and began to show the disparities, because we knew that diabetes and asthma and heart disease and all these other things made people more vulnerable to COVID-19. Well, we knew that there's numbers in these communities were significantly higher than in the white community, right? And so we knew that this community was more vulnerable, and nationally, African Americans were dying at 2.5 to 3 times the rate of the populations in which they were coming out of. That was happening here in Erie County, but because we mobilized, right, and worked with county government, with Kaleida, with Dr. Vasquez was a major player in this, and others, we were able to put the COVID-19 project in place, and we were able to lower the fatality numbers in this region to be in alignment with the population. And we're one of the few places in this country to be able to do that.
That's really a worthwhile effort to talk about it, because if I'm not mistaken, initially there was a reluctance by the African American community when it came to COVID vaccine, which kind of ties back into this Henrietta Lacks story that we highlighted at the top of the story. But talk about how that changed, because that's a big part of what you're talking about here.
Well, you have to have real authentic partnerships, right? So grassroots organizations in itself, just on surface, their ability to make change there's a ceiling to that, right? Institutions which have massive resources, right? They have to be able to partner with grassroots organizations or community-based organizations to not only come up with the solutions, but to implement approaches together in order to address the problem. And that's what we were able to do. We were able to partner with institutions, government, private industry, and private in the medical world and whatever, and with churches where we had our call centers, right? And we were reaching out with the National Witness Project, a great CBO that was knocking on doors. And we just built, we built a team, an approach to address these issues.
Pastor Nicholas, we did touch about this a little bit earlier on. Henrietta Lacks, a story from the early 50s. Quite a story in the sense this woman, unfortunately, African-American, she dies of cervical cancer. Her so-called immortal cells, though, get harvested and go and help with major medical breakthroughs. But the ethical part of that is nobody asked for permission, not from her or from her heirs as well.
And so the issue around Henrietta Lacks really, and the fact that immortal cells, and but yet her cells were immortal, but she wasn't.
Right.
Right. But the main thing really makes me think about is just the relationship in general with people of African descent in this republic, and the issue around consent, and the issue around the valuing the humanity of Black people, right? And how, our humanity was robbed from us with the enslavement of our people since 1619, 1519, go back into the South and Central America and the Caribbean, and from 1619 to 1865 and really beyond. I don't think the Emancipation Proclamation was finally ratified in the state of Texas till like 1917 or something crazy number like that. And so you think about, the fact that people can feel they have the right to harvest your cells, right? Or the right to experiment upon Black women in order to develop the art and medicine and procedures around gynecology. If you think about all the experimentation upon Black bodies in the medical field, so the Henrietta Lacks thing was not the only thing.
No.
It's one of the most well known. It really just the issue of just consent and feeling like certain people feel like they have the right, to take something as personal, as intimate, as a part of your body, right? So it wasn't enough to rob us of our culture, of our identity, of income, of our way we practice religion, all kinds of stuff. But now feeling like you have the right, the supreme right, and in some people's mind, a divine right, which is clearly it's not, to take that, and the fact that good came out of it is not relevant to the point of the process that occurred. And then when you think about the pharmaceutical industry and others who, wherever there's medical advancements, there's also profit.
Yes, that's for sure.
right. And so people made money off of this, but it wasn't Black people. And so there's some serious ethical issues that are related to, the Henrietta Lacks story. There are huge ethical issues around a lot of medical practices, and I use the word practice intentionally, and the relationship of people of color. And also, when you think about the development of vaccinations and other things, that oftentimes, clinical trials and stuff may have only been done on people of European descent, and then the slight variation of between a person from European descent and African descent could have an impact on how effective whatever drug or thing was created out of it. So I think it's a really important conversation that we have now, so that we don't repeat this. Because a lot of stuff when people start talking about AI and all this other stuff, again, there's another opportunity. We got to have Dr. Jamal Williams from UB on. Because he's brilliant about this, and he does a lot of research about genes and cells and all this other stuff, and how this stuff, the medical world is going to really get really deeper into technology, and but is it going to be designed only for people of European descent and not people of African descent? And it's trending that way. And so it's such a sickness, really, that we've had in this country since its inception, to devalue and undervalue people of color. And it's just we gotta break through. It has, at some point, it's got to stop.
The Henrietta Lack story, that's early 50s. Here we are today. What are we seeing with relationships with individual African Americans who are going to their doctor? What kind of relationships? Is there still that kind of lingering,
Yes.
I know better than you,
Absolutely,
patronizing kind of thing that just, it's got to be a huge barrier when it comes to health?
Yeah, I mean, there's a number of books out. One called Medical Apartheid that really talks about the relationships with doctors and other healthcare professionals and people of color. And the lack of listening and validating the humanity of the person that's sitting in front of you, and coming to assumptions about them just because of the color of their skin. And that's something that's, again, documented. It's a real problem in the healthcare world. And we see it a lot in the area of maternal health.
Okay.
Right. And so where, African American women are 3 to 4 times more likely to have poor birth outcomes than white women. And even black women who are professionals and have access to care and stuff have worse birth outcomes than white women that are living in poverty. Yeah, it's just crazy, right? And a lot of that has to do with, again, stress and trauma of institutional structural racism, the lack of prenatal care resources, but it also is related to, the relationships that a lot of black women have with their healthcare professionals. And even we've seen, Serena Williams, one of the most prominent black women in the world, almost lost her life giving birth to a child because her provider wouldn't listen to her. Beyonce had challenges when she had a child. And again, this notion that, when a black woman speaks, she doesn't know what she's talking about, even if it's related to her own body. And there's a reason why you don't see a lot of black people who are hooked on opioids and painkillers. Well, one of the main reasons is because black people are underprescribed.
Really?
Yeah, I mean, it's so deep. I mean, there's it's just this notion of just the lack of just seeing black people as human beings in this country, and seeing us as having the same wants and desires of peace and security and prosperity and the ability to care for our children and see them prosper and to care for our seniors. I'm on the master plan of aging for the state of New York, and just looking at how the issues of dealing with aging in this state, and again the issues of disparities, and the challenges that our black seniors are having that are more pronounced than what our white seniors are having around a lot of issues.
Can you give me some examples?
Well, again, housing,
Right.
quality of care. in our daycare facilities, nursing home type facilities. I mean, as a person that gets around a little bit.
So you go to some of these facilities?
Yeah, and they're not equal. They're just not. And
is it disturbing?
It's extremely disturbing. And just access to affordable housing with support and services, and then we're thinking about how the wealth gap plays a role there, right? So if you don't have a lot of wealth and stuff saved up, then it's going to impact the level of care that you're going to be able to either provide for yourself or to provide for your mother and father, aunts, uncles, whoever, right? So that wealth gap, it kicks in a lot of parts of your life, but it really kicks in on a lot of ways when it comes time to caring for our seniors, because a lot of times, because of the journeys in this country, a lot of money that our seniors have saved had to be invested or given to their to their children or grandchildren, to just basically survive.
Right.
And then when you see the disproportionate amount of African Americans that have engaged in the criminal justice system and the disparities in bail, people, they jump to so many conclusions about bail reform and all these other issues and student loan stuff and all this stuff, and all these things have there's a disparity in the impact. I read a study once that said that like 25 years after a person has graduated from college, about 90% of whites have paid off their student loans, and about 90% of blacks still are paying on them. And so there's just all these things that just push. There's just this constant pushing down. There's data shows that the impact of systemic racism begins to break down your body, and so because stress, we have to change. What we're doing is not working, and it doesn't mean I'm not being critical of people who are doing great work. There's so many organizations that do great work trying to, as I put their finger in the dam. But we need systemic change. And that's what we're trying to build through this movement. That's what we call it igniting hope, because it's aspirational.
That was Jay Moran with Pastor George Nicholas. And we end the show with our conversation with local artist and leather craftsman Dame Powell, who stopped by leading up to the Fig Fashion Show that took place in late September to discuss his inspirations and how he discovered his passion.
You made quite a debut in the fashion world and the outerwear design world.
Yeah.
You've started up, you're the owner, you're the founder of Dame, and simply Dame. It's a name that hopefully becomes synonymous with bags, with designer bags, with backpacks, leather works. That's what you dabble in, right?
Yeah, I mean, and I would love for it to go even further, honestly. My background started in like clothes and stuff like that. So, I believe my very first garment was a parka that I've ever made. Like, I just woke up one day and was like, I'm gonna learn how to sew. Went to Walmart at 2 a.m. back when we used to have a 24-hour Walmart. Bought I think it was a Singer or a Brother, and just went to town.
You did like a little bit of backwards engineering on it.
Yeah,
kind of
so
ripped it up and saw how it was made to put together. And...
Yeah, so what I was doing was just taking apart several different jackets. When I made my very first coat, I took apart, I want to say three of them, and then I kind of just fused it all together, mixed and matched, and added pieces that really resonated with me, and wanted to pull aspects of I guess childhood and environment and we put together a nice. I keep saying we, but it was me at the time. It's the only we now.
The formal we.
Yeah, the former we. So, yeah. So like I spent so much time just and at the time I was technically homeless. So, yeah. So what I was doing was like I would try to like go like to my mom's house when she wasn't home, and just do as much sewing as I could in between time. And then if the environment was okay, like I would even just stay the night and sleep on the floor, and then by the time I woke up, I would head back to work. Or I used to have to, like, when I first started, I was doing like van services and stuff like that, and you like transport like the elderly or the disabled to like their appointments. So what I was doing was I was just keeping the keys, and then I would go sleep in the van.
Wow.
Then, wow. Yeah. So eventually, I was able to save up some money, get my own apartment, and then I just turned my entire spot into like a sweatshop.
And then more importantly, a sewing machine.
Yeah. I took my sewing machine with me. So and then like I would store it at like a best friend's house or something of that nature.
That's where it really took off. Once you had the means, the equipment to start creating and fostering your passion.
Yeah.
That's where it took off. If I'm not mistaken, I mean, I don't want to blow up your spot or take away from the noteworthy work you've done so far in such a short period of time, but you were relatively new to this craft of leatherwork, right?
Leatherwork, 100%. I was like I said, I was doing fashion. I was doing like clothes in like 2013 or so, and then I want to say 2020. I got into leather crafts because no one was really had any place to go, as you know why. So I was just looking at it from a perspective. I'm like, well, eventually these folks is going to want to leave their house, and I was just looking at book bags and stuff like that. I'm like, because I was just getting ready to get into a job that required traveling, and I was like, I want a bag for myself, and I just couldn't figure it out, and I was just started watching Instagram videos and YouTube videos, and I found myself like just making a wallet first. I was like, well, let me just get the basics of what it is that I'm doing here, and eventually I was able to make a backpack eventually, and then it kind of just blossomed from there. And this is before I even had like an industrial, like before I even knew what sewing machine I even needed, because I was like, oh well, I have a good sewing machine, I'll use this one. But it was just for like fabric, not leather, and I found that out the hard way by breaking a bunch of needles.
That one I know. I know you need specific sewing machine for leather as opposed to
So a lot of my original garments pieces that I used to make, far as leather goods are concerned, were actually all 100% hand stitched, no machinery at all. I just was doing it like, I guess you would say, the old fashioned way, with just pricking irons and a hammer and just 2 needles and a thread, and going at it. And it really taught me a lot and showed me what you can and can't do, and what would be possible, and how to like configure design based on your ability of what it is that you have the means to do. So yeah.
And I don't know if I've stated it yet, but born and raised in Buffalo. This is your home. It's been your home.
Yes.
And now we're with the Fig Fashion Show, the Fig Buffalo Fashion Show. The idea here is to hopefully make this spot a welcoming destination for high fashion. Something that we'll get into in a little bit more detail, but I'm just curious now. Your current trade takes you to multiple places. You travel. When you go other places in the world, what does it mean for you to be from Buffalo? How do you convey that you're from Buffalo when you're out of the city?
I generally say it's pretty warm here, wherever I'm at, and then they're like, "What do you mean it's 50 degrees?" I'm like, "This is a Buffalo summer." And then they're like, "Oh, you're from a very cold place." Where most folks even think Buffalo is like in Canada somewhere, and I'm like, no, not quite the true north that way, but no, you kind of just Here's the thing. You're very well accepted when you're from a town like Buffalo, because you kind of relate to almost everyone there. You don't have this chip on your shoulder in the sense of like, oh, I'm better than you. It's like we tend to have people with I guess some more humble beginnings type of thing. Like we can have those type of people gravitate to you, folks who are looking for other people that are down to earth instead of full of themselves. You know what I mean? And that's actually how I've been able to garner all of my relationships out of town, is just talking about like the everyday basic stuff, I guess. I mean, and I guess like things that are particular to Buffalo, like, so when you like, we're known for what, food and just our tailgates and
Wings and football.
Yeah, wings and football, bro. Like
Maryland's crab cakes and football. Or
Yeah.
wings and football.
Yeah, I mean, listen, but the other part of that though is like wherever I go, I wear my own brand, obviously, like especially like my old garments and stuff like that, and that creates a conversation. And the first thing they want to know is like, well, where are you from? Like, where did you do this at? And tell them from the town.
And it's an eye-catching logo. I love it. It's a cheetah with Dame, big bold uppercase letters, and the slogan, "Run with us."
Yes.
Love it.
Yes.
So you start getting an interest in fashion, in clothing, then you move to Leatherworks, and then when do you say, all right, I'm running with this, I'm moving forward with this? What was the aha moment? What made you pursue this further?
I mean, the aha moment came really once I think I posted my first video of just making a wallet, and then like I sold like maybe like 10 or 11 of them or whatever, and then I think I was selling them for like pennies on the dollar. Like I think those wallets were probably going for like $30-$40, and like I was just using leather that I have found like around the house type of thing. Like I was just cutting up like NFL balls and not knowing what I was doing, just like, I'm just gonna cut this up and make a card holder out of it.
A pigskin wallet.
Yeah. Like, and then that's what actually intrigued the men to doing it, right? And then so like how my clientele even built, and how I realized what I was doing was worth anything, was I would make like football wallets or whatever, and then the men would like, like, oh, I really like this wallet, and then Christmas would like come around or a birthday would come up, and I was like, I think I want to get my girlfriend something. And then like, and at that time I was just like, I could do like, maybe like a tote or something, like something super simple or whatever. And then eventually what'll happen is like they'll gift their girlfriend like the bag, a bag or whatever, and then the girlfriend like, oh, this is so nice, where'd you get it from? And then they're like, oh, I got it from this guy, he makes them personally or whatever. And then like the wives double back to me, and they're like, so like, this is what he got me, but let me tell you what I really want. And we pretty much built it off of just that. And like I've been able to build relationships with a lot of my clients. Like I remember like almost everyone who's ever bought from me, but folks who like really like I've, over the past few months, I've been learning like, oh, I actually have like real people who like care about what it is that we're doing here, where like they'll show up to pop-ups, not even to buy anything, just to be like, hey, like
I need to meet
I want to meet you, and a lot of them they buy, and some of them they don't, but the fact of the matter is that like the content that we create and the stuff that we're doing is resonating and touching people, and then like a lot, like I've had to tell my story 100 times over already, so, and I'll continue to do it because I think it's something that if it can continue to put a smile on folks' face, why not?
Well, going back to what you mentioned, how your genesis of creation of this brand, do you still hand deliver some of your work to your clientele? That's
if you live in the city of Buffalo, I'm coming to you. I'm coming straight to you. If you buy something of, if you're like getting like a full custom order, like we actually invite you over to like the studio, and we let you build a bag, like we greet you at the door with champagne and something to eat, and we pull out the color swatches, and our goal is to really sell. Like I tell like everyone that I come in contact with, like I don't sell bags, I sell confidence, and I sell self-esteem, and those things are quite important to me. And I feel like only because like I felt like I lacked them when I was growing up, so I'm like, well, at least I want to be able to dish this off to someone else who can use it. And I want people to feel like superstars, and I want people to feel like good about what it is they're about to get into, and when they pick up a bag that they spent this money on, that it came with a memory already before they even got a chance to even put it in their hands. It came with a great memory that they could tell someone else about.
A lot of bespoke work, a lot of
Yeah.
just tailor made.
Yeah. So like I said, we give you like that the LV experience that we all want. You know, when we go to like if you find yourself on like Rodeo Drive and they assume that you have a substantial amount of money, they treat you a little bit differently in there. You know, you get greeted with champagne at those places and stuff like that. I'm like, well, everyone's a superstar to me, so like you're gonna get champagne. You walk through my door.
The humility and yet an air of humility and confidence. I think that's the sweet secret formula that will take you very far. And because we mentioned, you start naming all the high end brands, once again, quote unquote high end brands, Balenciaga, Versace, Gucci, Christian Dior, Kate Spade. You're gonna get the brand, but you're not gonna get that.
You're not gonna get that treatment. You're like it's. You know, and I understand the idea of exclusivity and things of that nature, but like you have to at least give people a chance to get involved in that exclusivity, I guess. You know what I mean? Instead of just handpicking them yourself. But you know, what we've discovered is the folks who buy into Dame, like they really buy in and like on another level without me having to preface anything for them. They're just like, no, like. This is part of my identity now, you know, and like how crazy is that as a designer to see people engulfed in your thoughts, you know, and then pay you for them. Like I tell Dana all the time, I'm like, look, this person just gave me pennies for my thoughts. Like, how crazy is that, you know? Like I just find that to be fascinating.
As a creative, seeing something go from the innards of your brain onto somebody, onto their body, and wearing it, and there's a pride. There's unmatchable pride there.
100%. The idea of just seeing someone that you just don't know, that you've never met, and then seeing them in something that you made, like,
and the reaction.
Yeah, and then like sometimes I'll you know, like, oh, you're talking about like after we present it. I'm talking about like a walking
in the process.
No. I'm talking walking through the mall and then seeing someone wear your bag is
the serendipitous
bananas.
Okay.
Yeah, but yeah, like that. Like for me, even the presentation of like, oh, okay, like your bag is done. Here it is, about to present it. Like that interaction in and of itself is a high for me. You know, like I'm going for that. Like I need that. Like, oh my gosh, you know, like just the pure joy and excitement on someone's face. I was like, all right, I brought happiness to somebody, and I hope that when they put that bag on or that garment, like I want you to have an air of confidence, like, yo, today is my day.
And part of that, I would assume, is the creative process of making and designing some of these bags. There's the regatta purse, which is a big seller.
Yes, that's our flagship bag. We actually recently
I saw the lime green one, which was pretty fire.
That was an exclusive that we had done for a social media personality. She was really great. Her name's Casey Kirihara. She was really cool. We got to work with her. And then but yeah, we've made multiple colors even since then. We have colors that are coming. But the regatta has been a staple in our brand, and I very surprised that it did so well, if I'm being honest. And the popularity is just continuing to grow, and the whole idea of the premise of the bag existing was bags are boring when they stand straight up and down. Like that was just like
that's what gave you some hesitation.
Yeah, I just went on like, well, what if we just turned it on the side? Originally, it was actually supposed to just be laid down
because
flat.
It's narrow, right on the bottom, and then it widens up on top.
Yeah, so it's shaped exactly, almost like a diamond in a sense. You know what I mean? And I just always thought it would be cool if like your bag could just lay down. And what happens is it creates a conversation. It's a conversation starter. When, you know, like I'll go out with Dana and like she'll put the bag in like the middle of a room and just like leave it there. And then eventually what happens is, whose bag is that? And she says, oh, it's mine. I'm like, oh, where'd you get it from? He made it. You know, I'm like, hi. You know, and then the ball gets rolling, and like it's rare that we show it or we go to a place and not walk out with like some type of giving a card or even someone just purchasing right then and there. We've been in instances where like a man and wife kind of just like, I think they bought like 2-3 bags from us like instantly.
His and hers.
Yeah.
Nice.
He was like, I want this for myself and I'm gonna get 2 of these for her, and like we're baffled every time, honestly.
Well, like I've said before, it's striking works. The other one that I saw was the Mariner, and that one has some special significance to you because what's that?
Yeah, so that one is like an ode to my mom. We've had a tumultuous relationship over the years, but it is much repaired now. And when I had created the bag, it was really like I gave her the same treatment as if I would give a random customer, and we showed her, and like we pretty much just designed this bag, and I'm like, I think this bag is like, it can't, like, it just needs to be more of them in a sense, you know what I mean? And I was like, I'm just gonna name it the Mariner because those are the memories with my mom where life was like.
That was
peak.
the apartment complex.
Yeah, it was the
Allentown.
apartment complex in Allentown across from Rex, and yeah, man, the memories that come with it, even the original color that it comes in, which is like this nice hazelnut, it just reminds me of that time in life, and to be able to present that to folks and then see like mother-daughter duos come in and buy bags, buy that bag in particular, like. I don't know, man. Just this heartwarming situation for me.
We mentioned it in one way or another, and you mentioned Dana. You mentioned the two important women in your life.
Yeah.
And almost part of the process here.
Yeah, you wouldn't even know me without
Behind every
Dana.
great man, ... Dana Culp, you're the marketer, marketing mastermind of Dame. You've seen Dame take his pride in his work and make it now something that he's sharing with the community and the world at large. How has that been, seeing that?
It's been amazing to just watch it unfold, and just like, we're still in our infancy, but it's just amazing just how far we've gotten and how much farther we are going to take it. But it's just a beautiful thing to watch.
Yeah.
You made the bag for her as a gift. There's no better gift
That's
than
how
a
it is,
handmade
yeah.
one. You made a bag for your mother, and that the feeling has to be unmatched. So it's I always liked hearing the story behind some of the works and the stuff that we take in and consume, and the genesis of it all, and that's part of it. I'm a huge portion of it, I assume. What drove you to be where you're at today?
Yes, I think that when we're making these pieces, I think what we lack in the, I guess, quote unquote luxury sector is the story behind the pieces. I mean, granted, there's a couple of them. Yeah, I mean, but I always tell people, I'm like, when you go out and you buy these bags, you don't even know why they exist. Like, do you understand, like, to someone this was art at one point, and to you it's just an item that you want to just wear? But like, when we have our meetings with our clients and stuff like that, we like let them know, like, hey, like, you're buying a piece of myself in a sense, and I want you to be able to understand what it is that you're getting into. It's just not something you want to just show people. It's more along the lines of like, hey, I have a piece of story here, and I want to show this story off. I want to tell this story for you, because we tell them why the bag exists if it's not a custom piece. But even if it is a custom piece, we still try to integrate, and I ask questions about childhood and things of that nature. Like, there's this bag called the Valencia that we created. It's just a bucket bag, but the way we styled the bucket bag was because the lady who originally wanted this piece, she was like, I used to have this Coach bucket bag in high school, and it just, like, I have so many great memories with this bag, and like, I would love to just be able to like recreate this in some way, shape, or form. And we was able to just rebuild that bag. But like, the reason that bag exists is because some woman wanted to relive her high school days through a piece of work.
And I wanted to kind of hopefully break some stereotypes here, because you do weekend bags, handbags, but you're seeing a lot of more bags that men are rocking.
Yeah.
It's something that, like, if you go far back, there's still very much, or even currently, there's still very much a lot of toxic masculinity train of thought that questions men wearing or rocking bags. What would you say to those folks?
Mind your business. Mind your business.
I've always been very jealous of women and having purses and bags because they're so
It's convenient.
it's very convenient. We have 3 pockets sometimes.
Yeah.
And can't have to fit our whole lives in there.
Yeah, and I was one of those guys for a while, and I was like, at one point, I'm like, I don't want to wear that no bag. You're like, what is that? Like, so growing up, I used to just carry a backpack all the time, and I would keep everything in there from like a change of clothes to like my dinner that night, especially like, like coming from my generation, like we actually used to go outside, so and play football on different people's streets. Like we would, like, going home wasn't even an option until you had to hit curfew, which for me, that those street lights come on, you better be on that porch, or at least mom should be able to see you by the time those street lights. Yeah, if she call your name and you ain't running within 30 seconds, it's a wrap for you, cuz. So bags have been a major part of my life, and then growing up, I kind of like, I'm an adult now. I don't need to carry all that stuff. But then as I get older, I'm like, oh, crap. Like, I need to keep more of these things on me. Even though, like, a lot of people treat their cars as if it was a bag itself. But I'm like, like, where are you going to keep your mints? Where are you going to keep your phone? Why do you want these bulky pockets and stuff like that, like just being weighed down?
Cell phones are just that much larger now. We went to small phones, now we're back to big phones. And
I miss my little flip phone,
me
man.
too.
I used to be able to put that in your back pocket and forget about it.
The little razor, razors where it was at.
Yeah. Or, like your chirps and sidekicks. I'm a sidekick kid myself.
I was one of the sidekick.
Yeah, sidekicks are fire. But yeah, I think that they have a good place in our culture. If you go to like New York City, you see men with totes. Like really nice totes at that. So, and they live a life where like going home isn't really necessarily something you can do right quick.
Good
like,
satchel.
Yeah,
a bunch of stuff in there.
Right.
It's not just a joke in a Hangover. They're really functional and really nice looking.
I think the idea of like not having a bag is a narrative pushed by people who live in smaller towns, where being able to hop in your car and go home because your home is within 10 minutes of your current location. I think that's something where that kind of like can stem from. But like if you get into, like I said, the bigger metropolitan areas where it's a 45-minute ride home if you forgot something, so it's best to just keep it all on you.
We thank you for joining us. This has been Producer's Picks. We would like to thank our guest, Pastor George Nicholas, and Dame Powell. If you missed anything and you'd like to hear it again, a reminder that this program is a podcast. You can get it wherever you get your podcast or the Amplify BTPM app, and each episode is also online on demand at WBFO.org. I'm Dallas Taylor. Thanks for listening.
This is the WBFO History Bites, bringing you a peek into significant historical events for the week of October 16th through October 22nd. I'm your host, Josh Deckert. On October 16th, 1851, the town of West Seneca was established. On October 17th, 1918, founder of the Buffalo Bills, Ralph C. Wilson Jr., was born. Wilson owned the Buffalo Bills until his death in 2014. On October 19, 1978, the Buffalo Convention Center opened. The facility now hosts job fairs, Comic-Cons, as well as the world's largest disco. And on October 20th, 1955, the Buffalo Skyway opened. Although a controversial landmark, the Skyway is still one of the most iconic Buffalo locations. You've been listening to the WBFO History Bite. Discover more stories about Western New York's past on the Buffalo History Museum's website. You can learn more at buffalohistory.org. For WBFO, I'm Josh Deckert.